So I'm trying to give you a potential scenario that you'll experience on your final.
Okay.
So expect medical and trauma.
Okay.
For sure, all right? You are dispatched to the lake. So we're in Chicago. This is Lake Michigan. For the drowning victim. Go ahead.
All right, I'll start off. Is the scene safe?
PD is on scene. PD and fire department, the rescue team has successfully pulled the patient out, and they're currently resuscitating the patient. CPR is in progress. The patient looks mottled, which looks bluish all over. Currently still in cardiac arrest.
Okay. All right.
Is there anything you want to do prior to arriving to the scene?
Yeah,
Get
PPE.
the AED.
Everything's there. Their ALS or BLS is on the scene, working the code.
Yeah.
They have their AED.
Yeah, we're gonna get our PPE on, so gloves, mask just in case.
Yep.
Okay. What else?
We have the
Scene safety. Which
Yeah, we already asked.
Scene is safe.
How many patients are there?
We have one patient.
Okay, mechanism injury or
Drowning.
nature of
Drowning.
drowning.
Okay.
All right, and then we have already
with the resources
And,
already there.
like, from the corner of your eye, you notice that every compression that they do, you see bubbling blood coming out of their chest.
Okay.
Okay, so they have a chest wound.
Possible sucking chest.
Yep.
Mm-hmm.
Okay.
All right, and then is there anyone like available that knows is related to them at all or anything like that?
No, this is a John Doe.
Oh,
Okay. He is unresponsive. We can't. He's A&O, obviously. A&O times 0, right?
Mm-hmm.
C-spine, we need to take considerations of that. He does have a second chest wound. It is bleeding, you said, correct?
Mm-hmm.
Okay, let's address. You guys want to address that? What do you guys think?
Yeah, we can do the what's it called the
Occlusive dressing?
Occlusive dressing, taping it down 3
Okay,
sides.
okay. The crew says, wow, I didn't see that. Great job, guys.
Thank you. Thank you.
All right, and then
AED says analyzing rhythm. Don't touch the patient.
Clear the patient.
Here.
Okay. It says charging.
And is there like an IGEL in the patient?
Not yet.
Not yet. I will prep an IGEL.
Okay. What do you want to know before prepping the IGEL?
The patient's weight.
All right. Patient weighs 150 pounds.
75 kilos.
I'm
Okay.
gonna
75
say
kilos.
Size 3.
70.
Okay. Let's go with the size 3. What do you want to put on the IGEL?
Some
Lubricant.
Okay. Lubricant. All right. AD says charging.
Mm-hmm.
Deliver shock now. Shock delivered.
As
Resume CPR.
As soon as the shock's delivered, I will do a jaw thrust movement, insert the IGEL,
Okay.
and then the compressions are still going. As soon as the IGEL is in,
Okay.
attach the colorimeter,
Yep.
and then the BVM at 15 liters per minute per
Okay.
oxygen.
Very good.
And we're gonna look for
Any distension.
What are the 7 things?
Color change.
distension and gastral distension, chest rise and fall.
Okay. Epigastric sounds.
SpO2,
Okay. Pulse ox.
skin
parameters.
parameters.
Okay. Skin parameters.
We said gastric dissension, any of that. Is there condensation in the thing?
Condensation.
Lung
Sounds.
sounds bilateral.
Lung sounds are crackles bilaterally.
Crackles
Crackles.
bilateral.
What about the color change?
What color is it?
Oh,
Gold?
gold is
Gold is
True.
good. The colorimetric
Yeah.
device. Okay. And then skin color still pale. Let's fast forward another 2 minutes. It says the AED says analyzing rhythm, don't touch the patient. Shock advised, charging. You deliver another shock, and a pulse returns, and you
Yay.
start to see the patient move,
ooh.
and then they start gagging like.
We lay them on the side.
Do we turn the patient? We turn the
Concession
patient to
to
the
Do
side.
you force them to keep the eye gel in?
No, we take
No, we.
No, I will take it out.
Okay,
Gag
let's remove the
reflex
eye gel.
Take that shit out.
Okay, and then they're like, and then
How's the airway?
how do we? It's on its way to being open.
Okay.
How do we continue our primary?
From there, we already assessed the major that is
What's
it's
the-
airway pattern.
Airway pattern. It's
Okay.
just on the way, but we're gonna go into breathing. now.
Breathing straight to breathing.
Okay,
How's the total volume?
tidal volume's adequate.
What's the rate?
Rate.
Fast.
Is it regular?
It's regular.
SpO2.
SpO2 is currently 79%.
Any accessory muscle usage?
No accessory muscle use.
How are the lung sounds?
Lung
laterally?
sounds are
You said
crackles bilaterally.
Bilateral, okay.
Okay. we want to go into?
The crackles. This guy, he's AMS as fuck. I would not.
How do we know?
We.
He just woke up.
after.
Man.
That's fine. Keep going with your primary.
He was just resuscitated. He was
we didn't
unconscious.
finish
He was
what circulation.
unresponsive.
Yeah. So.
Well, he's at. Well, what's the SPO2? I got 80.
SPO2 is currently 79.
79.
We can
79.
still do circulation if you want, and then go through.
You want to do that?
I
and
Yeah,
then
think
we
we
go-
address
You
the
say
oxygen.
AMS.
Let's just give the 15 liters for oxygen.
Okay.
via,
All right. So we want 15 liters on via what device?
Non-rebreather.
Non-rebreather. Okay. Let's move on to circulation.
Okay, skin color, any
Temperature,
sweating?
moisture.
Okay. Skin color is mottled, like pale to mottled.
Okay.
Temperature is cold, and moisture is moist.
Okay, and then how's the pulse rate?
Pulse rate is slow.
Strength, regularity,
Strength is weak. Regular pattern
Okay, is it equal?
and equal.
equal on both sides.
Yes.
And then how's the
Cab refill,
Over 2 seconds.
over 2 seconds.
Okay.
Well, since the possibility of a hypothermia, I say we do keep the patient warm, wrap
Yep,
him
shock-
up.
Have-
where
It's
we-
shock treatment.
Yeah,
Shock treatment.
basically
Okay.
laying supine after
Okay.
they got the gag
Do we?
reflex.
And what do we have to think about before transport decision?
The index and the suspicion.
Hypothermia.
Okay.
Environment,
So
yeah.
potentially hypothermic, right? Just spent who knows amount of time in the water.
Mm-hmm.
And then do we have a high or low urgency, sense of urgency for transport?
Very
High.
high.
Okay.
urgency.
And upon further inspection on the body, you notice some decap ETLS throughout the body as well. Okay. So with your mechanism of injury and nature of illness, there is some type of mechanism of injury here at play. And as the patient starts to become verbal, they say, oh my God, you saved me. Someone pushed me in the water. We got into a fight and someone pushed me into the water.
Okay.
Alright.
All right. Let's do a head to toe.
Head to toe, yeah.
Do we want to get any information first?
No,
We'll just do the head. You want to do the?
head to toe is
Like
what we have to do.
they're slightly like slow to respond. Like they're kind of coherent and they're kind of slurring their words.
We got to see what else is wrong with them at this point. That's why I say head to toe.
Okay.
So if you were to like backpedal just a minute, what do we do prior to the ABCs?
Exactly.
What's the general impression?
Half poo.
Yeah, general impression is they were
So
in a
where are
fight.
we in AVPU? If they're talking to you, we're at least
At least
A.
A.
So then, how do you go deeper and determine what level of
Alert.
of orientation?
Oh, we're just gonna
Questions.
ask. Do you know where you're at right now?
I think we're at the lake.
Do you know what day it is?
I think is it Monday?
Monday. Okay, so
It's
Can you
really
tell
Tuesday.
me? Yeah. Okay. And then can
Tuesday,
you
yeah.
tell me, just again, it's gonna sound silly, but what are the events leading up to what happened here? If you can recall.
I was I was trying to walk home from a bar. I removed myself from an altercation at the bar, and then the same guy that I had an argument with came up behind me, stabbed me a couple times, and then pushed me into the lake.
So multiple stab. Okay, well that's good.
I don't know how to swim.
Damn. All right.
So you
Okay.
got stabbed. You did get stabbed.
All right. So from there we can address. I guess. I mean, I could say age and sex if you want to, but
no, it's fine.
we
That's
can
that's
address
good.
extenuation.
Extenuation.
Okay, so from what you saw during the code, you fixed the exsanguination coming from the chest.
Okay,
Yes,
that's it.
Yeah.
That was your.
You said multiple stab wounds
For
though.
now.
For now.
Okay.
So then we can go into our head to toe. Right?
Yeah.
Yep. I agree. Head to toe. Any decap BTLS for the head deformities, contusions.
What do you? So, no deformities.
Contusions, abrasions, avulsions,
Yeah.
penetrations, burns, tenderness, lacerations, and
Swelling?
Swelling.
So there's some swelling and contusion to the left eye.
Just from the fight, probably.
Mm-hmm.
Okay. And then I guess can we like palpate the face, any tenderness and
Well,
stuff?
what else might jump out visually at you?
Or is he bleeding?
There is dried blood under the nose.
Okay. Any raccoon eyes?
No raccoon eyes.
How are the pupils looking? But we're at the eyes.
So you can't open. He can't even open the left eye. It's swollen shut, and the right eye is normal size and reactive.
See, it's swollen shut. Okay.
Can you say any battle signs? Did we
Yeah.
say
Any
that?
battle scars?
No,
Battle
no,
signs.
no battle signs.
how's the mouth? No blood? Is anything to suction there? Missing teeth?
No broken
possibly?
teeth. No vomit. No blood.
Okay.
He has a screwed up eye. Do you guys want to bandage
Check
it
that
maybe?
out.
We can bandage it
Wanna
if you want,
bandage?
but there's nothing. It's no impaling, so it's not like movement will.
I would say not to bandage.
No?
I think there's
going.
other pressing matters in hand, like
Alright.
Yeah.
the sucking chest
Yeah,
wound.
if you do it, maybe do it later.
Yeah.
Okay.
Yeah, we
We'll
can
go
move
to the,
neck.
let's go to the neck.
Is there anything else that might visually jump out at you? And if not visual, then how do we palpate?
We're gonna start at the back of the head. We're gonna palpate the back of the head,
To the scalp.
the scalp.
Okay.
Check
Around the
our
ears.
hands.
Okay.
To see if there's any
No
blood,
blood noted.
bumps. Then we're gonna palpate down the face,
Okay.
down the forehead,
Okay.
cheekbones, top of
Just
the
a little
jaw,
tender around the left eye.
Makes sense.
and then jaw.
Okay.
Mandible.
Nothing else noted.
Nothing else noted.
All
So
right.
now
Move on to
we-
the neck.
So neck.
Visual. What jumps out at you at the neck?
Any JVD? Any?
No JVD.
Tracheal deviation.
No tracheal deviation.
Decap BTLS.
No.
Bleeding.
No open injuries. No bleeding.
Subcutaneous emphysema.
So when we palpate, you're looking for subcu emphysema, at which point you don't find.
Okay.
And then what else do we palpate on
On
the
the
Any
cervical
injuries?
spine.
C-spine injuries.
Okay. It's a little tender.
Okay.
Let's throw a
say-
C-spine.
All
Let's
right.
throw
So
the
once the
collar
neck
over
is
there.
completely assessed, you would apply a C
Cervical
collar.
collar, yep.
Okay. So move on to the chest.
All right, once
Uh,
again, decap.
decap.
Decap
BTLS.
BTLS.
Okay.
We're gonna-
You noticed a penetrating injury to the left chest, for which you already applied a sucking chest wound.
Okay.
Major bleeding.
It is currently controlled.
Other than the second chest wound, paradoxical movement.
None noted.
Any
Subcutaneous
emphysema? Yeah, I was
emphysema.
about to say.
Yes, to around the left side of the chest
Left
when you
side.
palpate.
How's the breathing rate, volume,
Breaths.
It's adequate. What do you do with your stethoscope? on
Breath
the chest?
sounds.
Listen
Yeah,
for
listen
All
for
sounds.
right.
breath
So
sounds.
diminished lung sounds on the left side, clear
Okay.
lung sounds on the right.
So we have a possible
Pneumothorax.
pneumothorax.
Okay.
You said left side is diminished.
Okay.
And then how do we palpate if we're done visualizing?
We're gonna start the shoulders, work our way to the clavicle,
Yep.
down to
Down.
the sternum, out to the ribs,
And then flex.
Okay.
and then we
can
haven't
go to
done the abdomen. Yeah,
yeah.
now we're gonna.
Okay. All right.
Unless you
What do you? What might immediately jump out at you in the abdomen?
Any
Visible
swelling
masses
or
or-
discoloration, opened wounds,
What in trauma could be an open injury? What's that E word?
evisceration.
Evisceration. Yeah. I mean, it's interesting because in real life you would see it, right?
Yeah.
Yeah.
And no evisceration noted on this patient. No open injuries. In an abdominal assessment, what else are we looking for? Think color and size.
Yeah, discoloration
So
on the flanks.
discoloration,
And
not noted.
Visible
Is
masses.
Any garden?
No visible yeah, good. I like that.
Yeah,
No
rebound
guarding, no
tenderness,
visible masses.
the quadrants.
That's palpating.
Yeah.
No distension, no swelling. Okay. So with palpating, what do we palpate for?
Distension.
Swelling masses.
You would say-
Distension.
No, that's visual.
Yeah.
So when you look, you're looking for
Tenderness.
distension.
Tenderness.
Tenderness.
Rebound
Not
tenderness.
tenderness. No tenderness. No rebound tenderness.
Swelling.
Yeah,
Swelling
right.
masses.
Does it feel soft or rigid? So, all right. At this point, it's soft.
Okay.
And then
Unusual
what's the
masses.
cardiovascular issue?
We're using a cardiac arrest.
The
Heart rate.
do.
Any pulsating masses.
No pulsating
Pulsating
masses.
masses.
Right. And then while we're in our focused physical, think, look, listen, feel. So if we're listening to the abdomen, what would you listen for?
Gastric distension. No.
You keep saying distension, bro.
Lung sounds.
No, our lungs are up here.
Bubbling, gurgling. What's it called?
Not
Stomach
gurgling.
sounds.
What is it called? What's it called?
Oh my God. Stomach sounds.
Epigastric.
Epigastric
Bowel
noises.
sounds.
Bowel
sound.
sound.
Epigastric is stomach,
Okay.
right? We're
Yeah.
listening to the gurgling of the intestines.
Okay, yeah.
Peristalsis, present in all four.
Okay.
So then if we were to move on down to the pelvis, what might we visually see, if not palpate? Especially in patients with a penis.
Priapism.
Priapism.
Okay.
Priapism.
And then if we were to palpate, how do you palpate?
Push down and in.
Correct.
Yeah.
Down to the ground and into your hands,
Mm-hmm.
and stability is noted. Nothing is unstable.
Okay.
Okay.
So
Perfect.
now
Next
we're
one.
gonna move on to lower extremities.
Okay.
Yeah.
Decap BTLS. Any bleeding?
No.
Okay, so we're gonna palpate
Palpate.
offset.
Okay.
Offset palpating.
Counter pressure. If
Counter
you were to do it
pressure.
on Emilio, how would you do it?
On the leg, or
do
you
it
want
on-
to
Just do it on the hand. Yeah.
Yeah. So.
Good. Okay. And how do you do PMS on the feet?
Pedal
Gas
pulse.
pedals.
So how do you do
patient-
pulses on the feet?
The pedal
Pedal pulse.
Okay. And then how do you do motor?
Tell them to
It
push as hard
depends
as
on the
they can.
patient. Wiggle your toes
Wiggle.
or
Okay,
push down.
or push down like a gas pedal and pull up. How do you do sensory?
Pinch a toe.
Close
Pinch one
eyes,
toe at a
yeah.
time.
Big toe, yeah.
Which one am I pointing at?
Okay. Checks out for both feet.
Okay.
Let's go to the arms.
Same thing.
Same thing.
Same
Decap
thing.
BTLS.
Major
Okay.
bleeding.
Yeah, you notice like minor lacerations. Actually, let's say major lacerations.
Major lacerations.
Down the right arm.
Down the right arm. Basically,
laceration.
there's bleeding, I'm sure, correct?
We're gonna.
Yeah. So
we
let's
can
say
tourniquet?
let's say Jose's left arm is the patient's right arm. How would we address that?
Get a
If he's
tourniquet if it's
bleeding.
major.
Okay. And where do we apply a tourniquet?
2 inches
2
above
inches
where the.
above.
Okay. So
laceration
do we
is.
have a tourniquet on the table?
No.
Okay.
Yeah.
So Emilio, go ahead and show us how we
So it's
would
outside.
apply a tourniquet onto Jose's arm.
Here. So if the laceration, let's just say the laceration's right here, I'm going to put it about 2 inches above.
All right, pull down. Remove all the slack. Twist the windlass.
Crank it.
You want me to crank it on you?
Yep.
All right,
Stop the bleeding.
Said it. You good?
Okay, let's
Yep.
stop it. Keep going. Keep going. Keep going. Just secure it. Go ahead, and then you can pull the strap over it.
Make
Come,
sure it's
come
secured, yeah.
under the windlass, and then come back over. So like tuck it into the little brace,
Yep, the little.
and then come back under the windlass, and come back over, and then tuck it under the brace again.
What the hell?
And then we're gonna.
Back under the brace, under the lock part.
This part?
Yeah, tuck it there. Yeah, like that, like that. Just so it's not flopping
And
anymore.
then we're gonna
And I
time.
will time it.
Very good. Time. Very good. Okay, bleeding is controlled. If it wasn't, just like on your practice practical just now, you would apply probably an improvised tourniquet.
Yep.
Okay. So bleeding is controlled. Let's continue our upper extremity assessment.
I'm checking for crepitus
Okay.
broken by doing the offs.
Okay.
offset
Very good. Very
pulsations.
good.
Yep.
That's
And after the tourniquet, we will check PMS as well.
Okay.
just to
Pulse
make
is
sure
gone,
the
but
pulse is
motor and
gone.
sensory is fine.
Yep.
Okay.
All right. And then same on
With
on the other one.
on the other
Nothing
arm.
noted. No bleeding. No decap BTLS.
And since
Is
the
there any other body part that's missing?
yeah the back.
Okay. The back. How do we check the back?
So we would log roll. One
Log
person not
relaxation.
checking
Stabilize the
for
head.
neck stabilization
okay.
would be in charge.
And
One,
then you
two,
see
three,
bubbling
five.
blood coming from the left side of the back.
Exit wound.
Oh shit! There we go.
An occlusive dressing.
What do we put?
Occlusive.
Occlusive
Occlusive
dressing.
dressing. Okay, very good. You have another chest seal. You put that on. What else are we doing in the assessment?
Palpate the spine.
Palpate. Okay. What are you palpating for?
Any swelling, tenderness.
Okay.
stuffiness.
Tenderness, formy step-offs,
Emphysema.
and then around the back,
Irregular.
subcutaneous emphysemas, none noted.
Okay.
Okay.
The patient seems to be compliant. What would you want the patient to be doing?
Not moving his head. Just laying
Okay,
down.
Just-
and then we can move them to the stretcher.
Mhm.
They seem to be alert enough to answer any questions, or if you wanted to continue your assessment, what would you want to include in the rest of your assessment?
A
Just
neurological.
You want to do neurological?
Yeah, but I mean,
I would say let's
Maybe
Get-
cardiac? The OPQ.
Yeah, start anywhere you like.
let's just do OPQRC and sample just to get
well, let's
everything
first
we
let's
can.
get their information too. Like, okay, that way we can address like how alert they actually are.
Okay.
Once again, so like, okay, my name's Daniel. This is Jose. and
Okay,
Emilio.
but and well, I guess when you say information, are you going down focused?
No.
assessment.
Oh
Not
no,
yet.
Okay.
Okay,
No,
so-
I think we just gotta move on.
Oh, okay.
it's up to you. Up to you. This is your assessment.
Yeah, I would.
Because we did the AFP already when we first talked to the patient, so.
I
mean,
guess, but that was then when they were unresponsive. Now they're more compliant, so they can answer questions.
No, we did answer the question.
Or did
Yeah, we did.
Yeah, we
said-
did.
Oh,
Yeah.
my bad.
Yeah,
My bad.
yeah.
So we would move on to OPQRC.
Then
and
go ahead,
He
yeah.
did select the medical assessment.
Onset.
Yeah. So this happened suddenly. I'm assuming because you were
Very.
suddenly. Is there any?
Anything that makes it worse? Anything that
Anything
makes it
makes it
better?
better?
Position.
It's just over time, it's getting harder and harder to breathe.
Yeah, we have the diminished long sound. Okay. And can you describe it to us?
Just like struggling to catch my breath.
Shortness of breath.
Kind of like my chest and my back are sore.
Okay.
Okay.
Does that soreness radiate anywhere else aside from your back and chest?
No.
Okay. And
Out
if
of 1
you-
through 10, where do you rate this?
Maybe a 5.
Okay.
5.
And you said, and how long would you say?
Maybe 20 minutes ago.
20 minutes since you've been. Okay. All right, and then we can go into ample.
Yeah.
Yeah.
So do you have any allergies?
No.
Any medications?
No.
Any past
Medical
paternal
history.
history? Any past surgeries?
I used to have seizures as a kid, and then diabetes.
There we go.
Okay.
What do you remember the last time you ate?
Yeah, a couple hours ago, just pizza and beer.
And then the events leading up to present.
This guy snuck up on me, and I think he stabbed me a couple times, and then pushed me in the water.
Okay.
Okay.
Stabbed.
We can get vitals real quick.
Vitals. Yeah. What's the heart rate?
Heart rate is currently 110.
Blood pressure.
Blood pressure is 94 over 48.
Respiratory rate.
22.
The one eye pearl. I mean, not
reactive.
Pearl, but just reactive. Blood glucose level.
92.
It's not bad.
And then SpO2.
95.
New SpO2, yeah. 95 after the
We did give oxygen. So
oxygen.
Okay.
all right. Let's do
Any
focus. What are you thinking, cardiac? Or
Yeah, we can do cardiac and then move into neurological.
want to
if
do
you
both?
Yeah.
Just because he does have a history, so you know he could be a little screwed.
Okay.
Cardiac. Any pursed lip breathing? Did you? Or no. Sorry. Did you have any shortness of breath?
I do.
Okay. Any chest pain?
No chest pain.
No chest pain. Okay. Next one. Do you have any signs and symptoms of a respiratory infection?
No.
No.
Anything you're coughing up? Anything? Are you coughing anything up?
No.
No.
You're not coughing at all? Next one. I don't know the next question, but let's just go to the focus assessment. Any pursed lip breathing?
No.
No. Pink frothy sputum?
No.
Peripheral edema.
No.
JVD?
No.
Patient wasn't in tripod position when we found him.
Seems like you're going down a respiratory assessment.
Yeah.
No, isn't that part of the cardiac?
Or a cardiac assessment. No.
No.
Let me give you another hint. You smell alcohol in this guy's breath.
All right, so then we go neuro. Okay.
That's it, neuro.
Do you have any? Do you have a headache?
No.
Any head injuries?
My head is... No, it's fine.
Any blurred vision at all?
I can't see out of my left eye.
Okay. That's normal because he has his
Yeah.
eyes all screwed up.
Patient might be suffering from hypothermia.
Yeah, any environmental
Potentially.
issues?
Potentially.
All right, and then we can go into the next one. So, are you seeing things or
Hearing things that are not there.
Do you have any
No.
violent thoughts at all? No.
Yeah. Do you want to
No,
hurt
no
yourself?
thoughts of harming myself or other people.
Have you taken any drugs or alcohol? I know you said alcohol, but have you taken anything
Yeah,
else?
I'm probably like 20 beers deep.
Shit, and no one's around this patient, no family members, none of that.
PD and fire department.
Okay.
Okay.
Um,
And then you said you have a history of diabetes, right? What
Yeah.
would you say is normal blood sugar for you?
Oh, I haven't checked in a while. I mean, they're usually in the 200s.
Oh, man. Okay.
That's low.
90. Okay. And then
focused. That's we did hit everything.
no,
there.
no, no.
There's one more.
The environmental. No. Oh, catheter. Is there any kind of catheter? We
No
should know
open
about, anything?
wounds.
Yeah, or catheter.
And then, what would they be feeling hot to the touch or fever?
yeah,
Right? There's no fever.
Sepsis.
No
Yeah.
fever.
Okay. Focused.
Focus assessment.
Focus. Is my patient actively seizing?
No.
Incontinence. Sorry.
No incontinence.
Eyes, are they pearl?
Reactive on the open eye.
Okay. Any obvious head injuries?
No.
No obvious head injuries. Shit.
Discoloration, or is that the other one?
Discoloration of the abdomen?
Not noted.
Not noted.
I
Okay.
know it.
Thinking. There's two more boys.
Yeah.
No. I was gonna say that any signs of or paraphernalia, but that's
No,
the next one.
Yep.
Um,
Honestly, I would skip.
Just
I
keep
would
moving
skip
on.
it. I will keep
Yeah.
moving on to the focus. Let's do the fast assessment. The
Feel.
facial. Any facial droop when my patient? I asked
no.
my patient to smile. No.
No.
Any arm drift?
No, he complies.
He complies. Okay. How's the speech? Is it slurred?
It is a little slurred, but
probably 'cause
he's
of
also
the
20
ears.
beers deep, so
yeah.
who knows?
And we say that over the odor. I forgot to.
Oh, the odor of alcohol. You know, good one.
Yeah, well, he even brought it up, but
We're gonna try the finger to nose test as well.
It's good there.
How do we do that?
So basically, can you touch your nose?
and then touch the
And
finger.
then touch my finger. Can you touch your
And
nose
not move.
again? Can you touch it again?
Yep.
And then same thing, touch your nose
Uh-huh.
again. Now switch hands. Touch your nose, touch my finger.
Uh-huh.
Again, one more time.
Uh-huh.
I'll bring it over here.
Okay.
Okay, so
At PMS as well.
Right.
How is the pulse on all four extremities?
Present on all four except the left hand.
on all fours.
Which is fine because the tourniquet's on there. That's why.
Yep.
Oh, that's true. Yeah, that's true. Good one. How's the motor? Can he squeeze both
Yeah.
fingers? Can he push
Yeah.
down like gas pedal? Sensation? Does he feel pain? All right.
And then we do smell the alcohol on his breath. Okay.
So no stroke.
What else are you? What else might you smell for?
Sweet,
Ketoacidosis.
yeah.
Sweet.
Not noted.
I noted.
Gotcha. That's it on the focus. Are we miss? You guys think we're missing anything? Listening? No.
Just gotta keep going at this point.
Keep going. I would agree. I would agree 100%. So we
Okay.
got the vital signs already.
Yeah.
Well, he has a normal. You said your normal for blood glucose is around 200.
Yeah.
We can
He's
give some,
diabetic.
yeah. We can give some glucose if you want, or if he's
I would
able
say
to.
no.
He's at 92. I mean,
I would say
that's
no.
pretty
Wait,
good.
but
I get
if
what
his
you're
normal is
saying.
200.
I get what
go
you're
ahead.
saying,
Okay.
but maybe it's just me. I don't think.
You would give it to this patient
You
here?
I mean, why not? If it's either if they have no gag reflex, right? If they do have a gag reflex, then we can give the
I just
glucagon.
feel like it's under 70. No, I would say it's under 70. 92.
Okay.
Is the blood glucose? Is that just me? I just feel like we do not give.
Let's make a decision and move on.
Okay, let's skip it then.
Let's
I
just
say
not
no.
give it.
Okay.
Yeah.
Let's just not give it.
Okay.
We got vitals already. Secondary SpO2 is already 95%. Secondary skin conditions
Same.
it's still the same.
How are the lung sounds?
They are diminished on the left and clear on the right.
No signs of detention pneumothorax. Okay, so
Let's just we're done with the vital
Yeah, we
signs.
can
all
transport. Dude.
well we got a reassessment.
Let's
Just
just
reassess while we're
And
transporting.
that's how often.
Every 5.
every 5 minutes.
Okay. So what do you think happened with this guy? If you were to give a very quick verbal report.
He was okay,
Patient got stabbed, thrown into the water.
but he was altered mental status, so
Yeah.
he couldn't swim
Yeah.
out of the water.
So upon arrival, patient was found in cardiac arrest. ALS provided or BLS provided 2 defibrillations.
He was
We
resuscitated.
inserted an eye gel, and patient was resuscitated after the second shock. And we continued with our primary assessment and found the patient to be a altered mental status. We established that there was a sucking chest wound initially as well. We applied a chest seal immediately. We applied 15 liters per minute of oxygen via non-rebreather and started to perform a head-to-toe. And through the head-to-toe, we found additional penetrating injuries at the back, as well as
Left arm.
arterial bleed in the left arm, for which we applied a commercial tourniquet. No medical history, no allergies.
History of
Patient is under the influence of 20 beers. Blood sugar is 92. Vitals are 94 over 48. Heart rate of 108. Respiratory rate 22. Pulse ox 95. Pupil is reactive in the right eye. Swollen shut in the left eye. ETA of 5 minutes. Any other orders?
Great.
Sounds good.
All right. Thank you, guys.
Well, we got a
Emilio,
practice.
Jose, Daniel.
We all got a
Was that? How would you rate yourself 0 to 10?
That was like
Like
5.
a 3, man.
Yeah.
I would say an 8, if not a 9.
Really?
You
Yeah.
guys did great. I
Oh.
expect nothing but less, nothing but more
Wait.
on the actual practical. So thank you for doing this.
Sweet.
I think it was helpful. I think you guys are ready for the final.
Really?
Thank you.
Ah, sweet. Thank you.
That was awesome.